Thank you, Dr. Kim, for clarifying our doubts on cost effectiveness in India. I think this is a very, very big concern, the cost of higher end techniques, and you've tried to clarify. But then we had one question which is very fundamental in the Indian setting, is that when we have so many different states with so many different rating, private versus general, that means government aided versus private hospitals and patients paying out of pocket more than the insurance companies really. How do you start? What is the starting point for defining cost effectiveness in these type of patients?
Well, that's very honestly speaking, I'm not even sure there is a way. So now European countries now they are doing the micro costing, which means they kind of go by each like a step by step cost. And then they started actually 5 years ago, and now they are starting like publish their own micro costing setting. But USA absolutely no way, not yet. Yeah. So but the USA, when we did the analysis, like a big Medicare reimbursement, maybe 80%, and the about 20% is the out of pocket. That's how we kind of sorted out. But this is very different between healthcare setting, between insurance, between country. That's why Europeans started their own thing.
And this is also very different in our country because the cost of therapy changes per hospital. The same thing that costs probably, again, just giving an example, $100 in a government center might cost maybe $900 in a private center. And you sort of define cost effectiveness when you have a very wide range of costing.
Yes, so that's why in USA we use only Medicare national rates because Medicare is done by government. And the UPMC, we have our own healthcare. We don't care about what we reimburse, what we get, what we cost, what we charge, what we bill. It doesn't matter. We can bill $20,000, but we get reimbursement from the Medicare government only $5,000. That means we have to see, even though I thought that we did $20,000 work, we get only 5,000. That means the government sees, this treatment is only $5,000. That's how we have to deal. So that means that it's very, very hard to quantify. That's why we go by just standard rate, which is Medicare only in USA.
Unfortunately, in India, we have too many different states, and each state has their own Medicare sort of schemes, and they all define differently how they will reimburse a particular treatment. So it becomes extremely challenging to even start from somewhere.
Right. So there should be some centralized quantified number, like between all 5 or 10 sectors have to combine and see what's the mean number or median number, and then go from there. That's the only way.
Right. So I guess it was an exciting talk and an exciting day.